Hello, good morning. Welcome to the Real Health Conversations podcast. I'm your host, Holly Jean, and I am joined with Elie Jarrouge, Dr. Elie Jarrouge today. Hi.
Hi, how are you?
Hi, good. All right, Dr. Elie is a board certified and licensed medical doctor specializing in coaching patients in nutrition and improving their metabolic health. And if you've seen him on social media or online, you can see he has countless testimonials from patients reversing obesity and type 2 diabetes. And I'm really looking forward to having him share his insight and wisdom with us today because I have been following him on Instagram for a long time. And I really feel like you have mastered the art of putting out a thought or an idea or a fact and making it succinct and hard hitting. And I love your content. So
Thank you.
welcome to
Yeah,
the
I kind
show.
of I didn't because everybody was doing reels and fancy stuff, and it's not my nature, so I didn't want to do any of that. So I started simply just putting my tweet out with more details. It kind of worked, so I kept doing it.
Yeah, it's good because it makes it so it's easily shareable. It's like a
Yeah,
bite-sized piece of information that can catch someone's eye and attention and really get the conversation going because I think metabolic health is probably one of the most important things we need to be talking about right now. And I do feel like other people are kind of seeing that and agreeing and following that that same idea that this is
yeah,
stuff that we need to talk about and that we need to get out. You have a really compelling story, and I'll link your story from your website in the show notes so people can go read all the details. But why don't you tell us a little bit about how you started out working in the hospital and then got into nutrition and
sure,
to where you
sure,
are now?
absolutely. Well, growing up, I was one of the few people who knew what they wanted to do. I always wanted to be a doctor, so I saw a doctor come home, treat my grandma back in Lebanon. So it was always something I really wanted to do, take care of people. So I was on this track, when I moved to the States, I went to college, get MCAT, medical school, just went on this track, and then got into residency. And after I finished internal medicine training, I decided to do a kidney specialty training called nephrology. And then after that, I actually went back to just working in the hospital. I actually did not enjoy treating chronic diseases at the time because I thought there was no management, there is no treatment, just pills. So I tried to avoid that. Figured the hospital was more acute, like there's stuff you can fix and help people in a more dire situation, which I enjoyed. And I did that for 9 years. But my health wasn't getting better, or actually, I was healthy and I started getting unhealthy in my training, 20s and early 30s, packed on 35 pounds or more, had developed high blood pressure, chronic back pain. It just wasn't feeling well, but there was no sudden anything. And I couldn't figure out what was going on until my back I kept throwing out my back. So I have a cane that I started to have as a souvenir. So during that, so I just had to do something different. There was nothing wrong physically with my spine. I went on a Whole30 diet, paleo diet style, and all of a sudden I started feeling better. So that led to a 4 year journey of experimenting and learning about this stuff, Whole30, paleo, then I tried ketogenic diet and carnivore diet, and just kind of dabbling with different things. And my health continued to improve more and more, and I lost all the weight and more than I was leaner than I would ever have been. And no blood pressure, no back pain, everything got better. So this is when I became very interested because I treat the end of diabetes, the end of everything, heart issues, cancer, and I was like, I cannot fix anything there, and I wanted people to learn early on or reverse this stuff before, but it was scary to switch. But the pandemic hit, and I was taking care of COVID patients, and then the same theme: obesity, diabetes were the ones who end up in the ICU and dying, and became so like restless that I just wanted to do something different. That I started doing online coaching, and I had no idea what I was doing, but I was just started posting online and tweeting, and it started slow and it slowly picked up traction, and I started pivoting away from hospital medicine and coaching more and more. And I pulled the plug in January, and then I became completely dedicated to metabolic health management. And now I work online, and I stay active on social media, try to help people as much as possible to reverse their conditions.
That's awesome. I don't think I've realized that you just transitioned
Yeah, just
recently.
in the past year, yeah.
Yeah, that's really cool. So how have your colleagues taken your transition?
Well, they're excited for me because they saw me before I became more passionate about it. I was changing, and they saw, and some of them would do something with me or tease me, but they knew I was kind of a health freak in the last few years. So they weren't shocked, but they was like, "Are you sure?" Because I'm pulling the plug from safety of a paycheck, insurance, I mean, all this stuff. Like, "Oh, you don't want to practice medicine?" And my response was always like, my heart wasn't in it anymore. And for me, practicing medicine, sorry, my cat just and practicing medicine really is about food. I believe now that food is medicine. Prescribing a pill doesn't make it any special. I actually want to stop the pills, and that's what I love to do. And it never gets old. Prescribe a diet or a lifestyle that you learn how to do, and then you deprescribe or stop the medication, and you just get healthy. And when I see diabetes reverse routinely, and high blood pressure reverse routinely, it's like I wouldn't want to do it any other way. So they're supportive, but they I don't have a lot of risk. So like other people have family and kids, and they don't want to take such a big risk. For me, I was like, I can always go back to hospital medicine if things don't work out. But luckily, when you speak out, when you're passionate about it and you don't make money the focus, you just want to help. I think you just things happen in life, it takes care of you.
Yeah, I agree. And I do see a lot more physicians kind of taking this route, and maybe not necessarily going the independent route, but there's more and more like direct primary care type models
Absolutely.
popping up. But it's like it's allowing physicians the freedom to actually practice medicine. And once you take that insurance model out of it, I feel like it gives you guys so much more freedom to actually like work with a patient and see what's going on and address those root cause things. So I applaud you for doing it. I think more and more physicians should. And so I think that's absolutely fantastic. You recently made a post talking about people waking up one day and being like, oh, I'm sick, I need to get better. But you mentioned how for most people, our health deteriorates over time. It takes years, sometimes decades, and maybe you don't notice it because we're so used to just ignoring symptoms or taking a pill to cover the symptoms and not ask any more questions. And so when someone's finally sick enough to make changes, their instant thought is like, okay, well, I need a quick fix. I need some instant results here. But you and I both know that nutritional changes, they can be felt immediately. Like once you remove the junk,
Yeah.
those nutritional changes can be felt immediately, but it can take some time to hit your weight goals or to hit your health goals. So what is your advice to someone who may be frustrated with slow progress, or maybe progress that's just not meeting their expectations?
I always tell people don't compare to other people. Everybody on their own journey. Just compare to yourself from a week before, a month before, and remember that it took you years to get to the worst health of your life. It's gonna take you a little longer than a few days to reverse that. So weeks and months, and some people even a couple of years to really heal. But as long as you're getting better and you're making progress, that's good. You just have to be persistent, discipline, and just keep your why in mind. Why are you doing this? I mean, if it's only for vanity, you just want to look good, a lot of people kind of give up and things like that. But if you think about health, you want to be there for your kids and grandkids and reverse diseases, just have some bigger reason than just what the scale shows, then you'll notice a lot of changes. People sleep better, come off medications, skin looks good. I mean, a lot of improvement happens. So my advice to them, just be patient, persistent, because the alternative is sicker. So that's not the way to go.
Yeah. So you've been doing this for a while. What do you ever have days where you're just like not motivated to stay on
Absolutely.
track? So what helps you
Yeah, actually,
to
got a
stick?
pimple here because the other day, I don't know, I was on at Whole Foods and there's these wafers that are clean, but like coconut oil instead of seed oils and some glucose, no fructose. But I love them. But it was on sale, and I just, you know, I was weak and I bought some. But I opened the bag after I ate dinner. The problem I realized is like it's a drug because I couldn't stop after one or two, so I overate that, and it broke out. So I was like, okay, this is a reminder
Yeah,
that
I
I'm human. I make mistakes. Just okay, it happened. I know it happened. Throw it away. Get started again. And yeah, sometimes I'm tempted, but generally I always have in mind it's by default for me. I want to eat healthy. It's not anymore. I have to force myself because when you first start, you're always like tempted and you really want this and that. But right now, I actually don't want the bad stuff. I get annoyed when I don't have options because I end up not eating. But yeah, I mean, I'm a human being and I still occasionally eat something that is not ideal, but it's not too bad. So
so it happens. So there's two things I want to talk about there. One's going to be like this idea of balance, but first I want to share. I just finished a group program where we did a 40-day sugar fast, and we finished just before Halloween. And so we did 40 days without sugar, added sugar. Well, that ended. So of course we had Halloween here. So a couple times I've been grazing in the kids' candy bucket, and I felt it. So like
yeah,
when I take on new clients, like one of the questions I ask is, do you feel fine after eating sugar? And a lot of times people say yes, but that just proves that you're so out of touch with your body and how it responds to sugar, because that little bit of candy, I had a stomach ache. I immediately like just felt achy. My joints hurt. The next day I was
exactly.
inflamed. And so it's like, and you mentioned you started with Whole30. And one of the things I love about Whole30 is you don't know how bad the food you're eating is making you feel until you stop eating it and
Exactly.
then bring it back in. So I like that you said that, because I think it is helpful to do the restriction at first. That way you can know how you feel when you eat things that your body doesn't agree with. And that in itself can keep you on track. You're like, oh, I don't like feeling like this. But there's a lot of gurus or influencers online that are always talking about balance and, oh, you can achieve your goals and everything in moderation and balance. And I don't know about you and with your patients, but when I'm working with people, I feel like balance is the hardest thing for people to achieve, because when they're thinking, oh, I can have a little bit of pizza or I can have a little bit of ice cream, that little bit turns into a whole weekend.
Yes, or a
So
week or a month.
yeah.
Well,
So how do you, yeah, talk to me about this.
yeah, so people who come to me have already have failed so many times. Nobody just come to me for the first time. Usually they struggle, they try it on their own, they went on different diets and spend a ton of money on different things, and they failed, and emotional eating and food addiction, all that stuff. So I always recommend abstinence from drug of choice for them, like alcohol, because they gotta go clean, and then eventually they do mess up, and when they do, they experience what you described, and it's like all of a sudden, like, okay, this doesn't feel good. Actually, the people who do the worst is people who actually don't experience the negative consequence of eating bad, and then they always kind of spend months and months trying to really recover. But people who have joint inflamed, they gain. Some people gain 10 pounds in a week just by eating a little bit bad, and it's all fluid inflammation. So I tell people you gotta abstain. Just it's not doesn't mean you're never gonna eat it. It's a white lie. Basically, what I'm telling them to abstain because I want them to eventually make a decision that okay, I actually don't want that. Because if it's coming from me, it's always gonna feel like I'm not allowed to versus I don't want to. So that helps a lot. At least a few weeks of nothing, and then when inevitably they cheat and they feel it and they learn the lesson.
Yeah, you brought up a good point that you want it to be their idea, because it is our natural human nature where if someone tells us we can't do something, then we're like, oh, yes, I can.
Yeah.
I think we're all little rebels in that sense. But I mean, since your whole focus is metabolic health, I mean, is the ultimate goal to be metabolically flexible so that when you do have those days or those times when you're not eating as clean, it doesn't set you back as
Exactly.
far. Like that's like the golden sweet spot. Do you want to talk about like how do we get there?
Yeah. So we have two fuel sources, right? So carbohydrates and fat, and protein is not a fuel source unless it's like extreme famine to break down. So by default, evolutionary and thousands of years, we ate more fat for energy than carbohydrates, and carbohydrates was limited for natural reasons, seasonal, and then the nature made us actually very, we want to make them very palatable because they're high energy. You can store them as fat for later use. But we were always fat adapted, meaning we burn fat by default at steady state. But with the modern junk food world, is very high in carbohydrates. So we're constantly primarily eating carbs to the point where your fat burning kind of shut off, and that has to do with the insulin. So as long as the insulin is high, you're storing fat. You cannot break down fat until you bring down your insulin. So to reach that metabolic flexibility, I have to tell people you gotta limit most carbohydrates, even the good ones, because although potatoes didn't make you sick, but when you're already sick, potatoes are not helping kind of approach. So limit that, fix your insulin, become fat adapted, and then in the future, when you find some balance and sometimes occasionally eat bad or eat junk, you switch back and forth and you can quickly recover from it.
I get a lot of pushback sometimes about fruit. And since you talked about like ancestral nutrition, like we didn't always have fruit year round, but
Yeah.
now we're being told that you're supposed to eat, I don't even know what it is, but it's multiple servings of fruit per day. So how do you explain that to people who are like, but what about fruit? Fruit's so good for you.
Yeah, well, I tell them the body that cannot tell fructose or glucose from table sugar versus the fruit, and the poison is in the dose. So when you juice and drink fruit juice, and I tell them the amount of sugar in that bottle of juice is no different than the can of Coke. So you're just getting bombarded with the amount of sugar. And then fruit has been genetically modified a lot to be sweeter. And then also it's year round. So one of my favorite fruit is figs. I mean, figs luckily remain seasonal. And in season, I can have a few and be fine. But if it's year round, I mean, sometimes you dry the fruit, which makes it even worse. Bananas, grapes, that kind of fruit is very high in sugar. And I explain to them the equivalent teaspoons of sugar, and then usually it's eye opening. Or if they're wearing a continuous glucose monitor, I don't have to tell them. Fine, if you don't believe me, try it, and you see that glucose shoot up, and then it's eye opening to them.
Yeah.
So
Yeah, those
fruit,
continual glucose monitors are pretty cool.
yeah, I mean, especially if you have diabetes, pre-diabetes, insulin resistance, you learn from it. It doesn't mean you should never have a spike. It's normal if you eat rice or you eat a piece of fruit. Yeah, you're gonna rise, and it's how fast you recover tells you how healthy you are. But if you rise and it stays you there for hours to come down, that's your metabolism is not functioning properly.
Yeah, I like that those are available to just about anyone now because you really do learn so much about yourself and your body and how it responds because anyone can just give advice like don't eat this, don't eat that, but you don't know how particular foods are affecting you unless you look at the
Exactly.
data. So
Right.
those are so cool. I want to talk about kids and parents and how parents feed their kids because you just recently also made a post and I reshared it. But my heart is with the kiddos. That's what got me into doing nutrition and working in my practice. And I know that we can be doing better for kids in all aspects of health in
Absolutely.
this country. But I get a lot of pushback on this topic. And I understand that there are like socioeconomic factors and limitations in that sense. And the system is messed up and we have food deserts. But I'm talking about parents and families who have the means to shop better and to buy smarter. What have you found works best when working with families to make changes?
It has to change. It has to start with the parent. You can't ask the parent to change their kids' food if they're eating junks, and kids like to imitate their parents too. I have parents change their lifestyle. All of a sudden, their kids want that steak or they want whatever they're eating. So it's not easy, and kids they don't know better. It's easier to never introduce them to this stuff or make it like a special treat versus if they're always on junk and trying to change them. You have an addict in your a young addict that doesn't understand, so you have to change that, be more strategic, or at least temporarily make the healthier version of their bad food. I mean, at least again, it goes back to progress. But the family, somebody has to take a lead. They have to change themselves. You can't change your spouse. You can't change anybody who doesn't want to be changed. But you have a responsibility for your kids because they're at a big disadvantage. Even, I mean, I'm 40 now, but even when I was a kid, I did not have this amount of junk. Yes, I ate junk, drank Coke and all that stuff. But right now, when I look back, there was no major obesity in kids, and maybe if we see one or two kids, that's like a big deal. Now I will go back home, so it's similar to the US. Like 20-30% of kids are overweight, and that's really sad to see. So parents have to take responsibility, and is I don't they're all excuses because they don't want to do it. And I have I feel bad saying it. Seems like I'm heartless, but really, if you want to do something, if your life depends on it, you will find a way to do it. All the junk food is costly. Getting sick is costly. There's so much hidden cost. So eating healthy can be economical. Eggs are cheap. Uh, some vegetables are cheap. The bag of chips right now is $4 or $5, so you can buy a pound of ground beef for that. So
Yeah, man, when you said they're just little addicts, like that paints a picture and it just breaks my heart, but it's true. And it has to start with us for exactly the reasons that you said. And no one likes to hear it. And I think this is where I get the pushback, but they really are excuses. Like most of us, and especially like if you're listening to this podcast and you're listening on your smartphone, like you have the means to make better choices, and it is excuses. It's, oh, I don't have time, or I'm busy, or and it comes down to taking a long look in the mirror and asking, like, is this the health future I want to set it for my child, and is this really the health future that I want for myself? And I can say that because I've been there, and I feel like when you've been there and you've been guilty of these things and you've changed, then I have more freedom to talk trash, I guess.
Well, that's the thing. I mean, there are people who have done it. I mean, I don't have kids, so I understand. Okay, you don't have kids, you don't understand. Fine, but I changed myself, and I changed. I help people change themselves and their kids. So there's a way to do it. Plus, there's a we use food also more than just for food, for nutrition. We use it as a pacifier. Kids are acting out, shove some sugar in their mouth. I mean, they did good. Give them. I mean, food should be used for nutrition, not as a reward for everything. And then they
Right.
grow into adults where the only tool to deal with emotional struggles and everything is just really the same type of food. So that has a long-term consequences. It's really bad.
Yeah. So it really just comes down to, as parents, like we need more tools in our toolbox that are just aside from just here's some food. And so I guess it's a multifaceted issue, but the truth is, if you want to change as a parent and you want your kids to change, then that change has to start with you. Okay, I sent a couple articles and I just want to pull a couple questions out of those, but before I move on, I just have to do a little plug for our episode sponsor. And this episode is sponsored by LifeWave phototherapy patches. And I've been using the phototherapy personally for me and my family. Now I'm using them with my clients, and the results my clients are seeing just continue to amaze me. Today, we're talking about the hormone balancing protocol, which is clinically proven to control appetite, suppress cravings, as well as balance hormones, improve digestive function, and increase organ function, and balance the hypothalamus, which is key in regulating the autonomic nervous system. So anyone trying to make changes, this is where it has to start. And this is all done without drugs or chemicals. I can tell you my clients are feeling energized, they're experiencing pain and inflammation reduction, as well as reductions in weight, stress, and anxiety. So to learn more about the LifeWave phototherapy patches, you can click on the link in the show notes that's called Hormone Protocol, or you can just email me, Holly at Holly Gene Health, with the subject line hormones to learn more. Okay, that's that. Let's move on. Okay, the first article I sent you is about 5 surprising ways to manage your blood sugar. And this is according to a dietitian. And in the article, it says that there are 96 million people in the United States with prediabetes and an additional 37.3 million with type 2 diabetes. Okay, in your opinion, how did we get these numbers? How did it get so bad?
Our food environment. That's simple. There was, I mean, before 1900, type 2 diabetes, well, they had different names, but such a rare event. Yes, it was mainly type 1, and that was an autoimmune process where, mainly kids, and they have antibody against it. But obesity was super rare, insulin resistance, where we didn't know it as that. There was no abdominal obesity, except in the highly affluent people who actually eat a lot of pastries and junk at that time. But the food, the industrial revolution and processing of food, creation of highly processed, hyper palatable foods, and flooding the market for, we became addicted society. We just eat junk. We didn't know. They didn't mean for us to get sick, but they wanted profit, and they engineered stuff to make it addictive. And that's how it started.
Yeah, and it's like, but we're now seeing the ramifications of that. Yeah, I see a big lag in the correction process. Like, I just feel like it's just getting worse with even more convenience and more junk food. And I feel like at this point we should be pumping the brakes, saying, okay, hold on, something's not right, something's not working. Do you think we'll ever get back to real foods, like as a society?
I'm not hopeful from a top-down approach, because the whole system is dependent on each other. Like, the healthcare system is really billions and billions of dollars to manage chronic diseases. So if you don't have chronic diseases, the whole system will collapse. You don't need all these hospitals, all these procedures and surgeries. So big pharma also creating all these fancy drugs to manage, again, chronic diseases related to diet. And then the food companies are creating all this food, that are actually feeding into the diseases. So the whole system is kind of codependent, and the person in the middle, us, are paying the price. So it has to start on a personal level. You have to make your decision and kind of step outside the system in a way and just start eating whole foods. People are doing it. I'm hopeful, like people at the individual level, I've seen it. I've only been doing this for a couple of years, but just in the past year, there's a huge uptake of people waking up and realizing, going to the doctor, all they get the same 5 minutes, same talk, same lecture, wrong advice, and nobody's getting healthy. And they're taking it into their own hand between Twitter and Instagram and other media. They're learning how to get healthier. So I think it's going to hit critical mass where it's going to become, you can't avoid it or you can't ignore it. And you can tell that from products, although I don't agree with a lot of these keto products, but at least there is enough demand that these companies are shifting focus to be a little less, more healthy.
Yeah, I think it's going to have to be grassroots. So I relocated. We were in Southern California. We're in Tulsa now. We live on some land, and there is a shift. I can tell you the trending searches for homesteading and gardening and doing homemade sourdough and raising chickens.
Yeah.
That is going crazy because people, I think it is going to be the people. We're going to start opting out of the system and going back into, they're making that slow
More of a
life
village.
sexy. Yeah. And it's appealing. And I think people are just tired and we want different and we want health. So yeah, I think you're right. For pre-diabetes, I feel like that still is not really made out to be that big a deal. Like people go to the doctor and they see the numbers and the answer is always, oh, we'll just watch it. We'll just watch it. And I even feel like diabetes, type 2 diabetes, it's so common now that we've maybe become a little bit desensitized to it because it's just normal. So what do people need to know about pre-diabetes and like changes they can make proactively so they don't progress to that next disease level?
My post today was about type 2 diabetes. So the way you diagnose type 2 diabetes, usually a hemoglobin A1C of 6.5% or a fasting glucose of 126 milligram per deciliter, it's just as this arbitrary cutoff. So if you're like a point before your pre-diabetes, do better, eat healthier, whatever, exercise more. But it's a spectrum. I think of diabetes as a spectrum. You start, type 2 diabetes is the tip of the iceberg, but you have all these years behind where you're pre-diabetic or even normal, but high insulin level, insulin resistance. And that's all just kind of leading up to diabetes. So when you wake up one day, oh, last year I was fine, this year I have type 2 diabetes. No, you were fine 30 years ago and you slowly accumulated all this damage. So pre-diabetes is just as dangerous as diabetes. And insulin resistance is just a spectrum. And your increased risk of cancer, heart disease, stroke, you name it, fatty liver, all that stuff, it's the same thing. Obviously, the worse you are, the more dangerous complications are, because once you have diabetes and you have kidney damage, blindness, losing limbs, is just a lot more problem. So pre-diabetes should be taken as seriously as diabetes. And then people need to do a lifestyle. There's no pill for that. And that's probably why there's no focus on it. You hit 6.5, you can start metformin and do some other stuff and then really get the glucose to look good. But the problem is not the glucose per se. Yes, it causes damage. Problem is insulin resistance. And that goes back to the food. So you got to really change how you eat and know what raises your insulin, which is generally carbohydrates. The more refined, the more easily digestible, the higher the spike. It's not about the spikes. If you're continuously eating and snacking and your insulin never really recovers, you're going to develop resistance like any drug. Drug addicts initially, a small dose may work, but then eventually you need a higher dose to get the same effect. And that's what happens in your body.
Yeah, I think it's so common that people are hangry and needing a snack all the time, not realizing, oh, that's a warning sign, actually.
Yes, because the sugar crashes because the insulin overcorrected, but they're not equipped to use the fat, so they're stuck. They have to feed into that.
Yep.
It's a vicious cycle.
So this article recommends 5 tips for getting things under control. And it says skipping breakfast, eating dinner earlier, taking a 2-minute walk after meals, reducing stress, and avoiding diet drinks or things that are artificially sweetened. Do you agree with those?
I agree with most of the points. They're saying actually you should not skip breakfast. They want you to eat breakfast and have it earlier. And that part I don't particularly agree with. I think they're comparing people who eat normal food, including carbohydrates. So I think it doesn't make sense to eat when you're not hungry. So I always tell people, it doesn't matter. If you're not hungry, you shouldn't be eating. Your body doesn't need it.
Right.
But eating an early dinner, but in a low carb environment, it's a different story because not eating lowers your insulin more, and that's what you want. But of course, if you not eat carbohydrates, the reason your glucose gets better because you spike your insulin and you shove that glucose back into the cell. So you're just hiding it, not fixing the problem. There's a phenomenon called dawn phenomenon. You can have a rise in glucose in the morning, but that's getting into the weed of things. But generally, I think eat when you're hungry. When you do eat a protein-rich, fat-rich meal and keep carbohydrate low. Eating dinner early is a good idea because we all notice if when you eat late. We don't sleep well. I mean, I've seen even when they eat healthy but late, the glucose is a little out of whack at night. And so I agree with that. The rest of the points I agree with them. Walking, Zen, like meditation. This is has to do with stress and cortisol. When you lower that, your glucose control gets better. And diet drinks, yeah, it took him a while to admit that, but diet drinks just as bad.
Hey, but that's a win. They admitted it.
Yeah,
We'll
yeah.
take
No,
it.
I was really impressed that on today that they actually put decent points there. So that's good that they admitted.
Yeah, I agree. When I saw it and I was like, oh, from a dietitian, oh, this should be good. But yeah, it actually is not too bad. Okay, I want to just wrap up here. I know that you offer coaching and people can work with you. I've gone all through your website. I'm going to link that up for people because I know sometimes we just want someone to walk that walk with us and hold our hand and correct us because we've grown up our whole lives hearing the wrong information. And I think if you're open to relearning what you think you know about nutrition and you're ready to stop trying the same diets all over and over again, I really think you're doing a great job. So I will link it up to your website, which is metabolichealthmd.com. People can see all the ways to work with you. And you said you are on Twitter and Instagram, and that it's Dr. Elie Jarrouge on Instagram and Twitter. Correct?
Elie Jarrouge MD on Elie_Jarrouge on Instagram and Elie Jarrouge MD on Twitter.
Okay, and I will just do quick links. So if you're listening and you just don't want to search, you can just click a button. I will have that and make it easy to find Dr. Elie. Thank you so much for coming on the show today. Do you have anything you want to like add before we sign off?
Yeah, I think people just stop waiting and stop postponing and waiting for the right moment. Just start today. All my information is free. I mean, if you follow what I say, you will get there. Now, the coaching, because people need accountability a lot of times, and that's what helps. And I'm happy to work with anyone who needs it. But just start today,
Yeah, you don't have to wait till New Year's, guys.
Yeah, exactly.
We can start now. Okay, thank you so much. I really enjoyed our conversation. Listeners, if you found value in this episode, please share it with your friends or your family, whoever needs to hear it. And don't forget to leave the show a review. That is the end of today's episode. Our theme music is created by Andrew Bowden and production services are by Kevin Kennedy Spain. Discolite Media. Have a great week, everybody.